Good afternoon, everyone. My name is Nader Kabani. I'm the Director of Research at the Middle East Council on Global Affairs. It's my honor and privilege to be moderating this high level panel today on working together to address health challenges in the global south. So, despite global commitments and significant global investments on health initiatives, many countries are not making progress towards their health targets. These challenges will no doubt increase as donor funding potentially gets scarce with additional priorities such as increased commitments going towards climate change. So, really, we have to work together. We have to collaborate, work more efficiently, more effectively to really achieve impact. And that's essentially what this panel discussion here is about. And especially important is that we need to create space for innovative ideas to emerge from countries of the global south and to communicate these ideas more broadly and to bring them to global platforms. And this essentially is the motivation that led the Middle East Council on Global Affairs to partner with the Gates Foundation on launching the Doha Global South Health Policy Initiative earlier this year. And with the support of the Ministry of Foreign Affairs and the Ministry of Public Health and other stakeholders. So it's been a privilege to be able to be part of this initiative, and it's a privilege today to moderate this panel with leaders in the space to discuss and share their insights on how we can work better together to achieve global health outcomes. With me today, I have a very distinguished panel. Um, His Excellency Dr. Muhammad Ali Pate is coordinating Minister of Health and Social Welfare of Nigeria. He leads Nigeria's health sector renewal and investment initiative, and he has had a long and distinguished career that most recently included appointments at Harvard University and the World Bank. Sheikha Haya Al-Rahman Al-Thani is the Director of Strategic Partnerships at Qatar Fund for Development, where she manages a team that covers partnership development and planning and evaluations. She previously held positions with the Qatar Ministry of Foreign Affairs and Ministry of Defense. Dr. Chris Elias is the president of Global Development at the Gates Foundation, where he leads efforts to find creative ways to ensure that solutions and products reach people who are most in need of them. He has a long career working in international nonprofit organizations, including serving as the president and CEO of Pate. And Ms. Beyonce Gawana is vice chair of the board of the Global Fund to fight AIDS, tuberculosis, and malaria. She was Namibia's first ombudswoman and served as inaugural commissioner for social affairs for the African Union Commission and as UN Undersecretary General and Special Advisor for Africa. So we're looking forward to a very interesting conversation. We'll try to keep things tight and engaged. Um, Your Excellency, Dr. Pat, let me start with you. So Nigeria has seen progress in some areas of public health, such as resourcing primary health care centers, but the country still struggles with reaching some of its health targets. So, what do you see are some of the systematic barriers? What have you identified as most critical to address in the country?
Thank you. Thank you for inviting us to be on this panel to share some of our experiences. Yes, Nigeria has had initial progress in reducing child mortality, slight improvements in immunization, reducing maternal mortality. There are areas that we can say that, in fact, Nigeria has made progress, but it's not deep enough, fast enough, or significant enough for us to say we can rest on our. There are many structural barriers, some of which are our federal system, the fragmentation that had existed in the healthcare system itself had challenged the utility of the resources that we have, which are limited. So we need to be more efficient in terms of deploying, in terms of the collaboration between different arms of government, the federal government, the states, the local government, but also among our external partners. The hyper fragmentation that exists in development financing has not also led to the efficiency that we should have had. In addition, being laser focused on the outcomes, human resource issues, the distribution of the human resources was another challenge. And that led us to really revitalize the retraining, the expansion of training of the human resources. And we've trained almost 53,000 frontline health workers in the last 1 year so that they are deployed to the front ends. The financing, domestic financing, had not been, um, let's say, allocatively very efficient. It had focused on higher end care, which was not as efficient, to reorienting towards primary health care and expanding the functionality of the primary healthcare system is at the core of the president's renewed hope agenda, the health sector renewal investment initiative, to expand the functionality of the primary healthcare system, to prevent diseases, but also to deal with them very early on before they get complicated, and to expand the infrastructure, the human resources, the commodities, to have access to the services by making sure that population are able to afford that. So expanding the vulnerable groups fund so that we use the resources that we have and use it well while trying to also increase the financing domestically. And I think many of you here will know that President Tinubu has increased domestic financing for health, and we expect more. And asking states also to expand, increase their own allocations to health, not ignoring the private sector and other actors that have an important role to play in our sector. Another element in the context of the limited resources is to expand the healthcare value chain, to produce locally, because that is one way that we can begin to reduce our dependency on imports for the foreign currency that we don't have as much of. So, by producing generic pharmaceuticals, some of the devices, perhaps we could reduce the cost of those and make them more affordable. Those are some of the elements that we've been trying to do to rectify the performance gap. And over the last year and a half, I would say that we are beginning to see early signs of Nigeria making progress despite the complexity and despite the resource limitations.
Thank you so much. So, Dr. Elias, we heard from Nigeria and from Dr. Pate come to some of the inefficiencies that they face, but also some of the constraints, including financial constraints, that prevent them from kind of mobilizing all the resources they need to reach their targets. In your experience, the Gates Foundation has made significant investment in global South health systems. What structural barriers have you identified that limit the impact of these investments?
Thank you. And let me just reiterate my thanks for being here and for the collaboration with the Middle East Council. You know, our largest investments in health systems have been in Nigeria. So I could just say whatever he said is right. But if I think about our collaboration in many countries, there are a series of structural barriers. And I think Dr. Bate has summarized many of them. But to reiterate some of the critical ones is, weak infrastructure, particularly the human infrastructure, the frontline workers, the community health workers, many of whom are volunteers. There's a paradox in global health where we ask some of the poorest people in the world to work as volunteers, rather than training a professional group of people and compensating them to be on the job providing primary health care. Because we haven't done that, one of the other barriers, which again, Dr. Pate touched on, is even within limited resource envelopes, we see a lot of allocative inefficiencies where countries spend more on tertiary care in the capitals than they spend on primary health care in the rural areas. We know that the vast majority of health conditions can be prevented or identified quickly and treated simply at primary health care, and yet many countries and many donors put more funding into the tertiary care system than into the primary care system. So we need a bigger pie of financing because there's not enough financing in the health sector in most countries, in low and middle income countries, to drive the kind of results we're going to need to achieve the sustainable development goals. But even within that limited available financing, we have inefficiencies in how we utilize it. And we have a fragmentation within the development assistance community in how we work with countries to optimize that efficiency. It's one of the reasons that we've worked with the Middle East Council on the Doha South to South dialogue on health policy initiative to really bring the voices of countries to the table to say this is how we could optimize a suboptimal set of resources for maximal impact. That affects the health workforce. It affects our supply chains. One of the things that really harms health systems, and it's more than an obstacle, it's often a complete stop sign, is that when people go to health facilities and there's nobody there, or there's somebody there, but there's no medicines there, and they're told that they have to go and pay out of pocket at the pharmacy down the street. Very high rates of the total health expenditure in many countries come from poor people spending the limited resources they have out of pocket. So there's lots of challenges. Um, I think these are all solvable, however, and we've seen lots of good examples of how each of these individual challenges can be solved, whether it's the supply chain, the logistics, the training of community health workers. But what we often are doing is working on this piece of the elephant and not the others. So we have to really take the kind of systems approach. And I think as Dr. Pate was saying, Nigeria's been doing this for the last year and a half in a very concerted way, helping to coordinate the various funding streams coming into the country, as well as increasing their domestic resources to try and have really a systems approach where you can address all of these challenges together because they're highly interconnected. And if you only address one, you're often limited by the fact that you're not addressing the others. And so I think we have to take a more holistic approach of the problem and bring our solutions together as a community to solve that problem. But it's a solvable problem. And I think there's some very good early examples, Nigeria included, of where we can deploy an approach that actually does help us move the needle in terms of health outcomes. Thank you.
Thank you. Sheikh Hay Al Thani, Dr. Elias mentioned some of the systemic barriers and the need for a holistic approach to address some of these issues. But he also pointed to kind of the need for additional global financing and the fragmentation of some of the donor systems. From your perspective, what are some of the unique challenges that development-focused organizations and donors like Qatar Fund for Development, which is playing an increasingly important role in the space? Um, what do you see the challenges you face in pursuit of supporting and progressing equitable healthcare initiatives globally?
First of all, I'd like to thank the Middle East Council, of course, and the Bill Melinda Gates Foundation for having us here, for creating this platform. Honestly, I've read through the outcomes of the February meeting for the Global South Initiative, and the work that you are doing is immense, and it's certainly necessary at this time. So thank you for that to begin with. And I come at a disadvantage for speaking after you, Chris, probably because I will echo much of what Chris has just said. There are financial constraints, certainly. There are a lot of competing priorities out there in the world. As a developmental fund, I can tell you on each SDG, there are key partners that come at us and scream how urgent the matter is and how important one thing is over the other. And I think people here that represent the educational sector could, have an argument that it's more prevalent of an issue than the healthcare sector, and the healthcare sector will argue with the economic reform and so on and so forth. And therefore, it truly is about competing priorities. Where do we allocate the funds? It's not it's not an unlimited well that we are operating off of. We have to prioritize, and that's a major issue. I would say on the sustainability factor of things, an issue as well is our definition of sustainability, because the healthcare sector, by definition, is unsustainable. It's forever reoccurring, it's forever renewed. There are pandemics that deter our efforts, that remove resources, steer us away, pivot us from long-term goals. That's one component. Another component is there are issues that are not being tackled from the cause, and we're tackling the symptoms. For example, we can talk about lifestyle choices. Why how much of our funds are actually going to lifestyle choices that could prevent much of the diseases we're seeing, or hygiene initiatives that could prevent us from deteriorating in certain places of the world. But I had the pleasure of sitting into the round table this morning, and one of the things that our key partners, specifically in Africa, were talking about was that their region is very specific, and even the country itself, when they were breaking down their demographic and their, region by region issues, there isn't a one size fits all. And the issue is, most of the times when foreign implementers come in, they give us a one size fits all for tackling issues. And we're not talking about country based, we're talking about a whole region in which they tell us the best solution to, fixing the healthcare systemic issues in Africa is X, Y, and Z, and that's not really that doesn't translate well on the ground, I would say. And Chris, of course, you're an expert on this, and you can maybe illuminate further on the discrepancies that we see. But that's certainly that. And then on capacity building, we're talking about training people on the ground to continue on the efforts, but we're not looking at it as a holistic approach. We're not looking at it from an eagle eye. And if we did, we would say that the labor force in the country also plays a major role, because we're training these people, but are we maintaining them in the labor force? Are we paying them equitably? Are we sustaining them? Is the working conditions appropriate for us to have them there for 5, 10, 15, 20 years to sustain those projects? So I'd say that as well. And then, falling under the issue of communication, it's also about consorting efforts with partners. What are our partners doing on the ground? How can we avoid duplication of efforts to begin with? How can we fill gaps also? That's a major concern that's not really being tackled. Qatar Fund for Development is part of many coordinative bodies, and through those bodies, we speak to partners. Of course, we have partners like the Bill Melinda Gates Foundation. We have consortium of countries. We have the ACG, for example, the Arab Coordination Group. We try to speak there, but often people are working in their own track. They have their long-term goals, and that's an issue. And then finally, I would say another issue that we also spoke about today in today's meeting is that national strategies need to be in place for these countries for us to come in to support rather than to supplant, because you never want to substitute someone, you want to add to their function. So this is sort of a brief on what we face as key challenges, but I'm happy to discuss that further maybe.
Thank you so much. And Ms. Kwana, so Sheikh Hayal Thani mentioned some of the systemic barriers that they face as a donor and a fund and a development organization, but also some of the solutions that could help make things work more efficiently and better. But she also highlighted a couple of important points, one of which was the importance of prioritization, as well as the really the issue of how some of these efforts can be better coordinated across donors. From your perspective, especially since you're also looking at issues of how some of these global issues intersect, how education can intersect with public health, can intersect with climate change. What are the most significant systemic barriers that you see impeding health equity across the global south, and how can these be addressed?
I want to add my voice to the previous speakers and thank the organizers of the Doha Forum for inviting the Global Fund, and also specifically the Middle East Council on Global Affairs and the Gates Foundation for convening this. I'm also glad to note that we have the country Nigeria, the Honorable Minister of Nigeria, who's not just a board member of the Global Fund, but is actually a partner and a donor. And also the Gates Foundation, also an important partner in Qatari. So I'm in good company on this panel, and I'm sure they will add to my voice. I think when we are talking about inequity, I would always look at it as the high disease burden in the south, and those that determine whether people will live longer in the north. We have the manufacturers. Most of the manufacturing takes place in the global north. Now, what we found is, for the longest of time, there was always the question of access to affordable and quality medicine. And with the founding of the Global Fund, at least if one compares, for example, how much it costs to treat one person living with HIV, the annual cost to treat one person was about 10,000. Today it is 45,000, which means it is the collaboration with manufacturers, with governments, etc., that brings the cost down. But we must also recall that for the African leaders, African Union leaders, it was always a question of local production of pharmaceuticals. And that actually came to the fore even more when we had COVID-19. And so that's one of the inequities that one identifies as a structural barrier to overcome the mission. Another one that I personally feel that it will help us, and I think the previous speakers mentioned the fragmentation of interventions and the siloed nature of the interventions. That is a challenge. Now, sometimes I always hear, yeah, but the countries are not telling us what they need, or the countries don't have strategic plans in place. But I can assure you, having worked with ministers of health on the African continent, that there is no country that does not have a strategic plan in health, that does not know what they need. The question is, do the donors listen to when they are identifying their needs? And that's why there's always going to be this disjuncture between the needs of a country and what donors then feel will assist the countries. And I always hear the word ownership. And maybe that is something that we should really talk about. What does it mean to say country ownership, and yet at the same time not allowing the countries to take a lead? Now, in the Global Fund, we are very fortunate that it's a partnership. It's a stakeholder partnership made up of governments, private sector, civil society, and communities, those that are affected and impacted directly by the three diseases. And that partnership, obviously the private foundations. So it is a stakeholder board. It's a board that listens, but also in country, we have got mechanisms to make sure that those that are directly impacted by the diseases also have got a role to play in terms of explaining to us exactly what are their needs. Then capacity. And I want to address the issue of human resources from my previous life as a commissioner for social affairs. And one thing that we had not touched upon is that as much as we talk about human resource capacity, we cannot run away from the issue of migration. We cannot run away from the issue of migration, that many of the human resources in health that governments are putting money into, because I know on the African continent, most of the health workers, professionals, and community health workers are trained by governments. But those immediately, when they get the skill and the experience, where do they go? They go outside of the country. So there will always be that shortage of skill within the countries. And how do we address that? The migration of human resources for health to countries in the north. And so it's always about how do we invest in primary health care. And I'm glad that the minister mentioned that. But again, we know that we started with primary health care, and then it moved to hospitals, building of hospitals, and now we are coming back to primary health care. And I'm glad that that is a topic on the table. Thank you.
Thank you so much. And thank you for, I mean, you raise a lot of big issues here, including the importance of having local ownership. And then obviously the issue of brain drain and migration is huge. The issue of local ownership brings us kind of to the next topic we want to discuss, which is the title of the session today, which is really increasing global collaboration. Um, so, turning to you, Dr. Pate, how can other global South countries benefit from the experience and the innovations that are underway in Nigeria and that you're experimenting with right now? And what do you think you could, or what would you like to learn or take away from the experiences of other global South countries? How can this, as Dr. Elias said, how can this South-South learning take place?
Thank you. Before I respond to that, in the spirit of the Doha Forum, I would like to just make a couple of important points. I think in global health over the last 25 years, there have been investments, and we can see some of the results: HIV, malaria, TB, child mortality. So, indeed, investing in health has proven that, in fact, it yields a lot of dividends. At the same time, half the world's population lacks access to basic health services. So there are resources in the world. And we saw that we're just 5 years away from COVID-19, when we saw stimulus spending reaching trillions of dollars globally. So there are resources, either in multilateral development, in sovereign investment funds, in other sources of financing out there. What we lack is the political will to invest in a way that addresses the needs of humanity. And in an era where we are interdependent and interconnected, it's really a silly game to think that we can be in isolation. Guaranteeing basic access for everyone, investing towards that actually is in everyone's enlightened self interest. So there are resources. The only thing we lack is the political will. If you think about conflict and the cost of war, we have not talked about the dividend of peace. And how can that be channeled to investing in our common humanity? In the context of Nigeria, I think we've learned a few things. With the president and his transformation agenda, we feel that there are elements that we have to get domestically right. And the reform agenda we put together, bringing the federal government, states, and setting our direction, our North Star, rallying all actors together and determining our priorities. And thankfully, many of the partners, Gates Foundation, Global Fund, and others have aligned behind that to say this is what we are responsible, and we would invest and use our resources and are willing to be held accountable, just as we will hold others accountable for the results and responding to our citizens' needs. On that journey, in the sector-wide program that we have, we're beginning to see a path, at least domestically, to use the resources that we have, use it well, and achieve better outcomes. And we've learned from other countries in the region, and I believe that there are other countries in the region that are looking at what we have done to see how do they also learn. But one thing that we should be aware is, in this era that we are, no country, whether global south or global north, can actually assume that they are invulnerable or inviolable when health crisis emerges. When COVID occurred, we saw in Europe where even the most heavily invested health systems struggled. And we saw the so-called fragile health systems not bear the brunt for whatever reason. So when a crisis emerges, and I'm addressing this from the point of view of health security, that there are things happening in the global south that may be relevant. Social exclusion. If you exclude a population, whether they're migrant population or it can come back to bite you. If you're under immunizing your population, measles can jump from one group to the other. If you don't have basic healthcare coverage for everyone, multi-drug resistant tuberculosis might actually jump ship on a plane and be in your city. So that perspective needs to come in the dialogue, so that it's us learning from the global north, but the global north also being humble enough to understand that we're dealing with issues that have ramifications beyond our borders. And let's collectively, in our own self-interest, invest to ensure that no one is left behind. That is what we're trying to do under the president's leadership in Nigeria. And I believe that it's a good example that other countries are looking into and will continue to learn as we go, and course correct if we realize that, in fact, we've not, uh, if we falter, then we can course correct.
Thank you. Thank you so much. And Dr. Elias, you're in a unique position to kind of build on this view. The importance of ensuring, access, not just, across the world, and ensuring that there's basic levels that we're kind of a global community when it comes to the issues of public health. What do you see are some of the key innovations or key systems that we need to bring from the local level up to the global level that can ensure this kind of access? Um,
Yeah, so thanks. And you know, I think one of the themes of the Doha Forum, our discussion on health policy dialogue in the global South, has been innovation. And innovation is pretty much every meeting I go to, we talk about innovation because we hang a lot of hope on innovation for good reason. If you look at the scope of human history, we tend to innovate our way out of really complex challenges. And the good news is that the pace of science and technology is accelerating. And so the opportunities for new discovery to inform um, new innovations is tremendous. And when we talk about innovation in global health, we often make the mistake of talking only about technological innovation. And there are some very exciting technological innovations, right? We can, in difficult terrain in many countries, including some very low income countries, we're now seeing the use of drones to deliver blood to people who need transfusion in short time, to deliver vaccines to very difficult to access places where roads may be washed out, et cetera. But that there are those kind of innovations and new drugs and medicines and vaccines that could help to disintermediate some of the complex systems challenges we face today. But we can't be seduced into the idea that that's going to solve all our problems. That will help. But in the end, health systems are governed by individuals, often overtaxed and understaffed and lacking access to sufficient finance and data. So we also have to think about where are the innovations in health systems improvement. One of the things the Gates Foundation often partners with countries on is investing in better data and analytics to understand the current circumstances and to track progress and performance over time. We feel like that's a unique place for us as a philanthropy because we've come to understand how important data is to drive evidence-based decision making. Whereas historically, many donors were not so interested in funding data. They'd rather fund the vaccines or the bed nets or the commodities that you could tangibly see in people's hands. But the power of good information in the hands of uh, of well-trained decision makers is even more powerful. And that's where I think again technology is on our side. The potential for digital tools to actually help get better data into better decision making faster is incredible. We heard earlier today during our dialogue meeting from our colleague from Burkina Faso about their minimal data, minimal digital ecosystem, where they're digitizing various different parts of their healthcare system to create a more joined up and more efficient um, uh, system for decision making at all levels of the health system. Once we have that digital architecture, that digital public infrastructure in place, that's where even newer innovations like artificial intelligence will help us because it's excellent at pattern recognition. Now, recognizing a pattern and deciding to act on it in an intelligent way is a human skill. But being assisted by tools that can rapidly digest and find patterns to inform the people in charge of governing and financing the health system to make better decisions is another huge opportunity. Um, so we have to take a broad view of innovation and not limit ourselves to just technological innovation, but to think about it across the health system and, in fact, across the broader governmental system. Because Ashika, I said, a lot of the determinants of health are actually outside the health system. There's a lot that can be done before people get sick that would save the health system a lot in terms of changing healthier behaviors, diet, exercise, et cetera. So I think we have to take a broad view of innovation I think that the innovation has always been how we solve problems. And I think the pace of innovation is accelerating, and that the ability to use digital tools, including artificial intelligence, to help us make better decisions across the health ecosystem is going to be a powerful tool for solving these problems, given the challenges that we talked about in the first round of questions, where in a constrained financial environment with many, many other crises demanding attention, as Shekhar said, we're going to need to be more efficient about what we do. We're going to have to deploy the resources we have in a more effective way. And I think we'll be able to understand how to do that and how to track progress if we continue to innovate in how we understand and deploy data, particularly in an increasingly digital environment. Thank you.
Thank you. Sheikh Al-Thani, Dr. Elias touched on several points that you made, including, the issues that many of these fundamental factors are interconnected, and you need to broader look at them, as well as you pointing out that these solutions need to be sustainable. I mean, the health sector is one of those sectors that, you need to think about how it becomes that doesn't require like continuous support, but actually that somehow you embed in sustainability into the processes. Um, how is QFFT thinking about these issues? What is your approach to addressing some of these issues in the context of your programming?
I would say that, on the point of how are we doing things, Qatar Fund for Development is in the business of partnerships. So at the end of the day, we look to our partners, what they're doing on the ground, and we try to align what our objectives and our strategic goals are with what our partners are doing. Of course, we have the Bill and Melinda Gates Foundation here as a core partner, but we have country partners that we work with very closely. And just to my point on national strategies, the point has never been that national strategies do not exist. It's that our ability to reach them, translate them into our own policies is the difficulty. And there's a major communication gap that we need to, of course, as a donor and a fund work on, but also our partners, third partners and country partners need to also facilitate that maybe discourse. And going back to partnerships, we look at leaders.
Straight to make a bit, I think, for
Oh,
the
okay. I've never been accused of being quiet, so or soft spoken, so it's good that I'm doing that. But just on that, we are in the business of partners, as I was saying, and we look to multilateral partners, we look to country partners, we look at NGOs. What are people doing on the ground, and who's doing it best? And speaking of ego, there is no space for ego in our line of work. So we always look to evaluate, assess, self-correct, and there's no shame in saying that we did something wrong. There's shame in doubling down, I would say, into something that's not working. And we always look to that. If you see the structure of Qatar Fund for Development, a major component of it is monitoring and evaluating our partners, planning ahead of things, and then of course checking that things are being committed and followed through. So that's one component that we're certainly doing. As for the way in which we position ourselves, Qatar, or the state of Qatar, is from the global south. There is no positioning here. We are one, we're a part of this body. And His Highness the Emir often says that the reason why we're seen in places like Southeast Asia helping, or in the African continent or otherwise, is because if there's harm there, then we feel the effects of it here. It's at the end of the day, it's one entity, and we, Your Excellency, you mentioned, aptly, the fact that a lot of the foreign or the global north systems are very fragile, and for the longest time, and I don't know if you share this experience, but for the longest time we were spoken to from the global north rather than spoken with. That has dramatically shifted. We have, leading partners that understand the region very well, that understand the needs of our region. But we also have grown louder. We have sat down, we've elbowed our way into the table, and we're sat there, and now we demand to be heard and we demand to be taken seriously. And at the end of the day, we are a fund, so the money is located where we are. So we get to allocate it. We get to select and be selective where the money goes. And we're very fortunate at Qatar Fund for Development that the money goes where it's needed. It's not driven by any sort of agenda other than sustainable development globally. So just that.
Thank you so much. Ms. Guano, uh, Sheikh Al-Thani mentioned a couple of many important points. One of them is something that you raised earlier, which is the importance of bringing the voice of the Global South to the table. And another one that we haven't really discussed is the importance of course correction, of making programming kind of relevant for local context, and then identifying and responding when the situation evolves or changes over time. Um, what strategies does Global Fund employ to ensure that health programs are adaptable and responsive to the evolving needs of countries in the Global South?
Um, Thank you very much. When I was listening to the issue of innovation, it always scares me because I'm not a technical person. But the one thing that I know about innovation is you cannot hope to do the same thing over and over again and hope to have a better outcome. In other words, you recognize that you are operating in a changing environment and you have to adapt and be responsive to that. So, to come to your very specific question, I remember in the early days of the Global Fund, it was really a funding or making grants available for diseases. That's HIV, malaria, and tuberculosis. Over the years, there was a realization that you cannot just give medicine and commodities without also looking at the whole health system. And I think Global Fund must have been amongst the first organizations to recognize the importance of community health workers. And today, when we look back over the years, we see the difference that the community health workers have made. And I think that for me is when you adapt to a situation and say you might not always have professional skill, especially within the remote areas in some parts of the country. But also, just to throw in another bit, I remember when we were dealing with maternal mortality in Africa, and a lot of people will talk about maternity mobile ambulances and so on. But in one country that I visited, they innovated, not with modern tools, but what they did was they used a bicycle and put a cart on the bicycle because the ambulance could not reach. And part of the high maternal mortality was the long distances and access to clinics. So they could at least transport that pregnant woman to a nearby clinic. And that for me is innovation. It might look very, how do I say, primitive in certain, language use, but that is the case. I also want to say that the adaptability to changing circumstances is that in the past, Global Fund was always known as just providing grants to countries, but we had emergencies. We had the Mpox outbreak. And in that case, Global Fund could intervene and provide emergency funding. The same with a mechanism that we created during COVID called the CR C19RM. And those were the interventions that we could make. But most importantly, I think, and as Sheikha was saying, this is not the time that we will talk about this one and that one and that one. It's about collaboration. That's the point that I will always make. Collaboration, integration. Even there was a time that people did not want to talk about the link between SRHR and HIV or gender and malaria or whatever it was. Today we have moved on. It's not enough. Integration is absolutely critical. And Honorable Minister was earlier saying integration does not happen by just having policies and strategies. Integration happen when you actually look at the ground and see what needs to change, because sometimes systems prohibit us from integrating. But if we create the systems necessary, then it will promote the integration. And Global Fund, as I would always say, I mean, I'm only there for 1.5 years. I could never understand how the board functioned with so many stakeholders and different interests. But I can tell you, having so many stakeholders keeps us on our toes to say that the different interests and the different voices around that table must be heard, must be listened to, and that we be responsive to their specific needs and interests.
Thank you so much. I'm getting signals and red lights flashing. Please join me in thanking our distinguished panelists for sharing their insights and enriching the Doha Forum and this conversation.